Okay. Good evening, everyone, and welcome. I am so excited that you are here to celebrate the launch of Genderqueer Menopause. My name is Dr. Kristin Gianelis. I am a nurse practitioner specializing in women's and gender-related health. I'm also an educator. I'm a healthcare quality improvement specialist and a menopause certified clinician. And it is truly an honor to be here with you tonight. Before anything else, I want to acknowledge what a rare and meaningful moment this is. Books like this simply don't appear because the market decides it's time. They exist because someone sees a gap that's causing real harm, invisibility, and isolation, and chooses to build something better. We know that menopause care already suffers from significant gaps in education, research, and resourcing. When gender diversity enters that landscape, those gaps are widened dramatically. And many trans, non-binary, genderqueer, and gender-expansive people have navigated profound bodily change without language, without culturally competent care, and without being fully seen. This book meets that reality directly. It doesn't flatten complexity. It doesn't oversimplify bodies or identities. It offers grounded physiology, trauma-informed care, lived experience wisdom, and practical guidance that clinicians like myself, caregivers, and individuals can actually use. I have had the privilege with working in collaboration with Lasara in professional spaces, advancing gender-affirming menopause care. Their work is consistently just supports deep professional growth. It is interdisciplinary, um, it is thoughtful, and it applies to the clinical setting. They bring a rare clarity, humility, and care to complex systems. Uh, Lasara Firefox Allen is a trans and genderqueer author, educator, certified menopause doula and coach, founder and CEO of the Genderqueer Menopause Coach, and CEO of the Pacific Center for Human Growth. Their work integrates trauma-informed practice, equity-centered leadership, and gender-affirming education. These are all things that we desperately need right now. So tonight we'll move through conversation, then Lasara will share a short excerpt from the book so that we can experience the voice and texture of this work. And after that, we'll open the space for reflection and questions. And my hope is that this feels less like a presentation and more like a shared exploration of what gender-affirming menopause care can become with complexity, dignity, and lived experience when those lead. So please join me in welcoming Lasara Firefox Allen.
Thank you, Kristen. It's such a pleasure to be here with you specifically tonight. The work that we've done together has been so, as I was saying before in our little comments, just so mind-opening and altering for folks who've had the pleasure of being able to sit with us in this exploration, right? And so I'm just really pleased to be sharing this experience with you, and so pleased to have my publisher here, Tim McKee from North Atlantic Books, in conversation tonight. So I'm just delighted to have this moment to reflect on the work that is being done to create new standards for care for folks that exist in all types of bodies and experience all types of transitions. And
Mhm.
I know we're going to go over a lot of ground tonight. We have a nice little bit of time set aside to chat. Just at the out front, I'll say, gender affirming care is for everybody, not just for trans bodies. And we'll get more into that as we flow, I'm sure.
Mhm.
But I also just want to say that it is so important for us all to reflect on how rapidly the terrain is shifting, and for the practitioners who are in the room and who will be listening later to really consider in what ways they may be able to close gaps that they see existing. And I know we'll get into this as well too, but I offer a gender affirming menopause care certification course, and that you participated in, and
Mhm.
so that we will talk about that as well later.
Absolutely. And that was a fantastic course. I know we're going to get to that later, but I would love to hear. Let's start with where this all began.
Yeah.
Um, I'm always intrigued by what begins a book. What was the moment or pattern that revealed that this book needed to exist?
Well, I mean, I think for a lot of us, uh, that comes from, at least in our community, right? That this comes
Mhm.
from the lived experience perspective, right? We experience a gap firsthand, either for ourselves or for community members or both, right? And in my case, certainly both. Uh, I entered perimenopause in um, just over a decade ago, uh, a little bit over a decade ago now. Time flies. Um, and I was actually in the process of writing my previous book at that time, which was a very fascinating experience to be in the process of writing Jailbreaking the Goddess during that time period where I all of a sudden was thrust even more deeply into questioning my gender identity, even as a genderqueer identified person. Um, Perimenopause for me really stirred up a lot of gender questioning, and resulted ultimately in me finally getting to the point where I felt profound comfort with claiming trans identity, in
Mm,
the aftermath, honestly, of my hormonal transitions. And
mhm,
we'll get more into that later too. But to say that as a genderqueer identified person entering into perimenopause, the gaps were consistent and extensive. And
mm,
I was living in rural California, which a lot of folks don't know about rural California, that there is such a thing as rural California, and that in rural California that we have the same exact considerations that we do in any other rural space in the country. In that we have limited resources, we have limited access to care, we have large, income divides, all of the same considerations. So, as a genderqueer person existing in a rural climate, I had a very challenging time accessing qualified medical care just in general. Um, as we all know, there's a very severe shortage of qualified care in rural communities. Um, and add to that, that I was presenting as a genderqueer individual, requesting qualified care. And I would say, I am a genderqueer person and my pronouns are they, them. And my response was often kind of a confused, quizzical look, you know, and
mm,
then, you know, and then misgendering and complete like inability to contextualize what the words that were coming out of my mouth even really meant. And so that and this, I'm going to generalize out for a moment and say,
mhm,
uh, in these moments, anyone who is facing this experience has, can choose one of a few options, but the two predominant options are: one, do I confront my care provider and potentially sour the relationship? Or do I sit in my discomfort and receive what care I can? Right? And so that was the question. At what point does self-advocacy become a hurdle? to care? At what point does requesting the kind of care and treatment that would serve me most become a hindrance, right? So that was a really complicated walk to be walking in the middle of also not knowing what the actual hell was going on with my body, right? Because I did have some pretty extreme symptomology going on. And honestly, this was, 10, 12 years ago. We weren't having the same cultural conversation then about menopause that we're having now. So I didn't really know like what was actually happening. I'd been having intensification of my premenstrual experiences for years at that point. So I say I entered into perimenopause at that point, but I know that it was happening for quite a long time before that. Um, and I was diagnosed with PMDD in my late 30s, which was probably when the beginning of, right. So PMDD is premenstrual dysphoric disorder.
Yeah.
And that is like, it's like PMS on steroids. It's like, where you might feel like you get a little angry at someone and you think, wow, I'd like it if you went to the other room. Instead, you're like, could you just leave my life? It's like just everything is larger than it needs to be.
Yeah.
And then this is a tangential, but when I was researching the book, as you know, Kristen, because you've read it, but as I was
Mhm.
researching the book, I found out about premenstrual exacerbation syndrome, which I
Mhm.
had never heard of until I was researching the book. So, premenstrual exacerbation syndrome is where it's like another graduation of, a similar sort of set of circumstances where but instead of it being just your hormones amplifying your emotional state, it is your hormones amplifying any underlying mental health considerations that you experience. So, premenstrual exacerbation actually was more accurately what I was experiencing. And I was never diagnosed with that. I don't even know if they knew that that existed, right, as a diagnosis. So, all that to say, I was not getting the care that I needed. And so at that point, I started researching menopause care extensively. I started learning as much as I possibly could, and learned throughout the years what I needed to learn in order to advocate for the care that I needed.
Mhm.
And as I was doing that, I listened to a lot of like audible media, and I'd be listening and they'd say women this, women that, and I'd be like people this, people that, and I was just had this like track running. It was like an eraser running in my brain all the time, like where I was like erase that word and lay over the word that makes sense to me, and I was doing this sort of intensive translational work
Mhm.
ongoingly just so that I could sort of receive the information in a way that didn't make me feel more dysphoric. And so
Absolutely.
that's what led to the book. That right there.
Yeah. And certainly the intersection of being in a rural community and having a queer gender identity, that is intense. But I have to say, I'm not sure that the city was going to offer you anything different at that time.
Right. Right. True. True. Good point.
Um, so
Good point.
certainly,
Although in some ways
certainly there was less,
yeah.
but at the same time, I've been a nurse practitioner for 20 years.
Mhm.
This is not stuff that I learned.
Right.
Um, I all of my menopause education was done after the fact. When I
Yes.
went to school, we did not learn about menopause, and we certainly didn't learn gender-affirming care. And it was not until I started looking at learning menopause myself
Right.
that I said, wait a second, this is my frame of context, and why aren't these two fitting together? Um, not everyone who goes through menopause identifies as a woman.
Right.
And the language that we use in gynecology
Right.
is so fraught.
Yes. Yeah.
Uh,
Yeah.
it's
And,
something we
it,
struggle with.
yeah, absolutely. And in the book, I mean, I talk about not just the languaging, but the aesthetic of
Ugh,
menopause, right?
yes.
And just like I talk about like feeling like I'd been like puked on by a Pepto-Bismol bottle, it's like this like electric pink, like, and you know what that is? This brings us to one of my other like main talking points these days, which is as you and I both agree, uh, you know, gender affirming care is for everybody. It's for every single person, right? It's for everybody. So, um, gender affirming care is practiced across the board by those who practice gender affirming care, by anyone who practices what I mean, you correct me if I'm using incorrect terms here, but I've been calling it like pre gerontological care, it's not quite,
We'll call
we're
it
not
midlife care. We'll
right,
call it
right.
midlife care. Yeah.
But there's a whole segment, right, of like
Yeah.
where we're going from, in menopause care, in all of these different, sectors, right, where we are seeking out cis people are seeking gender affirming care.
Yes.
Right. We've talked about this in our
Yeah.
workshop that we offered at Nurse
Yeah.
Practitioners
Yeah.
Conference.
And you know what? Menopause care is inherently gender affirming care.
Correct. Correct. And I think that that's what all the pink is about, right? All of the pink coding of menopause, I believe, is actually a form of gender coding that is saying,
Hmm.
right? Without saying, you don't
Hmm.
need to lose your femininity just because you're experiencing menopause. So, and that's the big, I believe that that is why menopause is so intensively and extensively, femme coded is
Yes.
because the sort of the inherent cis fear of menopause is a loss of womanhood.
Yes. Well, if you look back, and this is tangential, but if we look back at the early, Premarin cream came out in the 1940s, 1942
Hmm.
it came out.
Hmm.
If we look back at the early advertisements for it, it was all from the male gaze
Yeah,
of keeping her feminine.
right.
And so I don't actually know if menopause was always seen as a reduction of, or if it was framed in that way.
Right, right. For sales. Yeah. Yes.
But
I mean,
for sure, that's where we are right now.
yeah, yeah,
There's there's advertisements. He's suffering too. I'm like, oh, give me a break. But I've got a whole presentation of it
yeah,
anytime you
yeah,
want.
yeah.
Um, but
Yeah.
you know,
So all of that, I mean, all of that is sort of just evidence of the fact that this book, Genderqueer Menopause, and other books like it that will surely be coming along,
mhm,
are so needed.
yes,
And that there's just so much ground that we need to cover in order to just get to the point where the bare basics are being served, right? So, and when I say bare
yes,
basics, I'm saying women, are not the only ones who experience menstruation and the cessation of menstruation. So, if we can get to, and I always say this, like in the sound bits the moments of time that I have, if you're a practitioner and you take one thing away with you at this point, let it be people who menstruate. people
Mhm.
in menopause, right? Let it be that switch. And that not just that it's that we're saying people who, but also just becoming aware of the gender diversity and also the gender, the gender diversity along with the fact that we need to uncouple and at the same time make space for the sort of relationship between gender identity and sexual expression and those basic, right? We're talking about basics of gender affirming care. We can't assume that the way someone presents is the way that they identify, and we cannot assume that the way that someone presents or identifies says anything about who they're sleeping with or who they're having sexual activity with, right? Or whether whether they
Yes.
are having
Yes.
any of that at all in any direction. So, the assumptions that are all the hetero patriarchal, assumptions that are just like wrapped up in all of it are just so sort of strong, like to the point of sort of substrata um,
Mm.
uh, definition
Yeah.
of the even of the parameters of the conversation, as you were saying, like where does the marketing stop and the reality begin?
And I think coming back to that, your book does a great job at reframing menopause as a transition,
Mhm.
not
Thank you.
necessarily as a decline.
Right. Because I
Um,
truly believe that. I mean, for fuck's sake, I mean, honestly,
like,
I've been trying to avoid swearing, but for fuck's sake, really honestly, we're hitting midlife. And for many of us, I say in the book, and I have said it in a number of places, one of the most consistent, I did a survey that where people gave me anecdotal stories that are all peppered throughout the book. And it's lovely. One of the most consistent sort of refrains that I got from that survey was no fucks left to give.
oh, I feel that deeply.
Right. No
Yes.
fucks left to give. And it was like, and it was not, I didn't say, do you agree with the statement, no fucks left to
Oh
give? No, I
no.
did not say that. I said nothing about it, but people voluntarily said, where I'm at right now is no fucks left to give.
Yes.
You
As a
know, and
clinician, I hear that in my office all the time.
right?
Yeah.
Right. It's
Yeah.
it's 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 like, and it all I think this no fucks left to give sort of mentality also has a lot to say, and I talk about this in the book, but a lot to say about our increase in diagnosis for autism and ADHD, our
Mhm.
increase in diagnosis of anxiety even.
Mhm.
Where we're like all of a sudden we're like, I don't care what you need right now. I need, right? And it's like almost the first time for some of us that we've been able uh, to get there. And
Yeah.
and I think that, I mean, from what I've read and from what I have, anecdotally heard from people too, there is a component of it that is just the bandwidth left over after dealing with the amount of like need that our own physiological and neurological and like every single system is impacted by estrogen. So as estrogen depletes, every single system is impacted from taste to your brain to your cardiovascular, like
Yes.
literally everything is being impacted. So all of a sudden you're going through this like trial by fire, literally, right? Hot flashes, et cetera, right? All of a sudden, we do not have the bandwidth anymore to mask effectively, which we've been taught to do
Mhm.
since we're in infancy as AFAB folks, right? We
Yep.
do not any longer have the ability to take other people's needs before our own because our own needs are so pressing, right? And so it's it's like a it's a blessing in disguise, right? Because all of a
Oh,
sudden, those of us who have been socialized to care, to take care, to, be constantly listening for the background, are all of a sudden saying, no more,
hmm.
no more. I need to listen to the inside for a minute, and I think that that is such a brilliant and beautiful rite of passage, honestly.
I love it framed that way. And I think there's such validation for people. There's such agency there.
Absolutely.
Um, and you know, this, I can't wait for you to read from this book. Um, talk to me a little bit about the, talk to me a little bit about the ways that you talk a lot about dysphoria and euphoria shifts. And I
Hmm.
think that speaks a little bit to that concept of reframing this,
Yeah.
is that this, you know, the menopause transition, because it is a transition, not a decline, the
Hmm.
menopause transition is not the same for everyone.
Right.
And so tell me a little bit about maybe your personal experience
Yeah.
with it
Yeah.
and also perhaps what you've seen in your work and, that would be great.
Yeah. Okay. So for me, I think I want to preface this part, and I think this is an important conversation to be had too. I want to preface this part by saying I I personally do not believe or agree with the designation of dysphoria as the defining factor of transness, right? As the defining factor of
Mhm.
trans identity. Unfortunately, it is factual that we do at this point in our trajectory rely on that for diagnostic criteria. And so it has become sort of coupled in a way that I think does not serve our community.
Yep.
And so I think as much as possible that if we at the community level can really continue, because I'm not going to say start because it's been happening, but if we can tease out that, conglomeration, right? And just
Mhm.
say, we need to claim dysphoria in order to get the services that we need. And that is unfortunate, but it's true. But it does
Mhm.
not need to be a cultural element of our internal relationships or our internal, self relationships even, right? That's the, yes.
Yes, speaking to the clinicians here, especially the medical clinicians here, the I have actually moved away from using those diagnostic codes to get things covered and
Hmm.
just started saying endocrine disorder,
Beautiful.
not otherwise specified.
I love that, Kristen. I love it.
The
I
endocrine
love it.
disorder, the endocrine system is just not what we want right now. So it's
Right,
not doing what we
exactly.
want. It's disordered.
We're gonna change it. Yes, beautiful. Love
Yeah.
it. Love the workaround.
And it's just
Um,
like I will not put dysphoria on someone who doesn't have
right,
dysphoria.
right,
Nor will I say that this is a disease.
right,
And
right.
I can't even write it down. So anyways, I
Yeah,
digress,
I
but
appreciate it. No, I appreciate it.
yeah,
That's perfect and beautiful. Love
yeah.
it. So that said, all of that said, I did have an interesting experience of the realization of dysphoria through gender euphoria. So I When I had gotten successfully through my perimenopausal experience and weathered my year without a menstruation, and then was deemed postmenopausal, and in that year leading up to that moment,
Yep.
I was like, oh my goodness. Oh my goodness. Like, this is amazing. This is phenomenal. I had had a very hard time with my menstrual cycle my whole life. From the beginning of menstruation on, it was never something that was easy for me. It was always very challenging physically, emotionally, psychologically. I did not know until I was in the absence of menstruation that some of that was dysphoria. I didn't realize until it wasn't happening anymore that some of that was dysphoria. So my sort of and not just the bleeding, right? It's not simple like that. It's not just
No.
the bleeding. It was the wash of hormones that happened that made me feel like I did not control my destiny, that I did not control my physiology, that I did not control my psychology. It was like this constant, I felt a constant bombardment by my reproductive hormones throughout my whole reproductive cycle.
It's funny that we call that premenstrual dysphoric disorder,
Right, right. I know. It is funny, isn't it?
like dysphoria. Like,
Yes,
yeah.
exactly. Exactly.
I'm not saying
Exactly.
everyone who has PMDD is
It
has,
has
yeah,
gender
no, but
dysphoria,
I'm just
but
saying, like, it does
it is
feel
funny.
like,
It does.
it's like
Yeah.
that washing through of just being like, and
Yeah.
I do think that when I read your book, I
Hmm.
think how many people will um may this may strike a
Yeah.
you know a nerve with them, and they may say,
Right.
"Wow, oh my
Right.
goodness."
Right, right, right. Yes. And so for me, when I had that realization, all of a sudden I'm like, oh, this is my body. I
Mhm.
own my body. I'm present in this body, and this body is behaving in ways that feel comfortable and at home to me. I was like, oh, I could track back to menarche the discomfort.
Mhm.
Right. And then that was a watershed moment for me. And it was during that time period that I finally felt able to claim trans identification. And that is partially because I had internalized that you needed to experience dysphoria in order to claim trans identity. Right.
Mm,
Right.
yes. Yes.
Right. Because I've been gender fluid, gender queer, I used to just say I'm a gender fucker, uh,
Yeah.
since I was in my teens, like honestly, even before that, when I was a tiny little child, I dressed in, and my parents were hippies, mind you. I
Hmm.
wore a newsboy cap and I learned how to tie a tie. No one in my life wore a tie. I don't know, but I wore a little tie and
I can see
button-down
this.
skirts and a
Yep.
newsboy cap, right?
Hmm.
Almost without fail for years and years from the time that I was like 6 or 7 years
I can
old.
see it. I can
So,
totally picture it. Yeah.
I mean, not all the time, but it was definitely one of my sartorial choices, it was definitely one of my personae. So I've always been playing in that space. And, when I was like in my early teens, like, David Bowie, Prince, Annie Lennox, like all of the gender fuckers were my faves, and it was because I saw myself in them. I saw myself in them and I saw them in me and I felt at home there. So like I've all and I was there are so many other ramifications and psychological components to it too that and some of it's socialization and some of it's what life demands of us and when I was in my late teens I absolutely passed as male.
Hmm.
I was, I consider myself male identified at that point in my life, late teens, early 20s. Um, I traveled around by myself. I hitchhiked a lot.
Hmm.
I picked up hitchhikers a lot. Did a lot of stuff that in the early 90s would not have been, as accessible to me if I were presenting as female. I mean, I could have done it, but it would have carried a lot of different risks than I encountered
Hmm.
in my, I mean, it was still risky, right? Because I was a tiny little, people just assumed I was, you know, a twink, honestly, and I was kind of a twink. I just wear a little eyeliner, military jacket, had no hair, like,
Yeah.
so my and then there have been times in my life where like high femme has been what felt the best, and like, and and that's why I say like the way someone is presenting in the moment is not reliable. It's not a reliable indicator as to what their gender identity is.
Yeah. So who is this book for?
It is literally for my community, first
Yes.
and foremost.
Yes.
And then beyond that, it is for the community of providers who are trying to serve us better.
Hmm.
And beyond that, it is also for our friends, our lovers, our families who want to understand how to take care with us
Yes.
through these transitions.
Yes.
So, and I want to say for my community, people who are gender expansive may experience menopause or menopause-like experiences multiple times in our gender trajectory. So it is
Amen.
important, yes. So it is
Amen.
important that even if you're 24 and you don't think that menopause is a thing, that you read this book. And if you are considering hormonal interventions or chemical interventions or surgical interventions, doubly important. Doubly
Yes.
important that you read this book because the chemical interventions and the physical interventions that you may encounter may have menopausal impacts on your body. And so be prepared, know the choices that you're making, know how to make them the best for yourself, and know how, and also a whole chapter is dedicated to self-advocacy. We talked about this a little bit earlier, but
Mhm.
and I want to say something about that. The chapter dedicated to self-advocacy is going to help you in all settings, right? It is going to help you at home. It's going to help you at work. It's going to help you in your medical encounters. It's going to help you across the board. And when I was writing that chapter, I got kind of sad and kind of angry because I was like, I do not want to be having to write this chapter for my community so that they can arm themselves against medical professionals who are not equipped to take care of them. I did not want that to be the reality. And that is what brought me to creating the training that you took, Kristin.
Yes.
Writing that chapter is what brought me to that. So, and sort of like the process of writing this book brought me to the juncture of realizing that the work that I really feel like I need to be doing is that upstream work, that provider-based work
Hmm.
that allows the provider community to get to the point where we as trans people are not needing to educate you as our provider about how to take care of us.
Absolutely. And, there aren't other resources right now for this type of education. We need to make more resources for this type of education, for sure.
Absolutely. 100%.
Let's talk a little bit about the shifting, practices for clinicians. I'd love to talk about what um, what was provided in your course.
Mhm.
You and I have an article that's coming out. It's a clinical article, so, the clinicians will be interested in this. The non-clinicians, not so much, but if you want to read a clinical article that will put you to sleep, go for it.
It's going to be exciting. Read
It's going to be exciting for us.
it.
But I think that we need to make movement as clinicians in this area.
Mhm,
Um, and the training that you put together really is about, I mean, it's number one, grounded in trauma-informed care,
mhm, mhm,
first and foremost.
mhm,
Um, and really talks about, systems level care gaps and
mhm,
really addressing um, a lot of the problems that we have with our language and with our, just even we have issues with consent,
mhm, mhm.
big
Yeah,
time.
yes. Thank you for
Yeah.
bringing that up, actually, because that goes into an area where we would be remiss not to talk about a little bit, just to say that trans folks are coming to the table
Hmm.
with a lot of medical trauma.
Oh, yeah.
And that's everything from sort of the stuff that I talked about, like misgendering and low level microaggression level stuff, which is still grates on you and is not easy to handle over time. But it goes from there all the way up to physical and sexual assault issues. So that is the reality that we're facing. And as providers, becoming aware of how to show up in space with trans folks from a trauma-informed perspective is really the only way to provide gender-affirming care.
Yes. And when we look at clinical practices, this is not a cookbook.
Right,
There's no cookbook here.
right.
In fact, it never should have been a cookbook in the first place. No part of care is a cookbook. We need to listen to each and every person. Um, but it starts with that trauma-informed perspective, that gender inclusive perspective.
Mhm,
What I really enjoyed was the aspect of sort of thinking through, this made me reflect upon myself.
mhm, mhm, mhm.
Um,
Yeah.
I'm not afraid to say that I always need to reflect on myself
Right. Don't we all?
all day long. But I've done this for a while. I teach nurse practitioners. I have taught in a medical school before. I've taught physicians. Um, and there is room for improvement. There's room for reflection.
Hmm.
Um,
Hmm.
and
You really came to it with a willingness too, and that goes a long way because the model of education that I offer is experiential, right? You're gonna get what you're gonna get out of it what you put into it, right? If you are
Yeah,
willing to show up in a way that allows you to challenge your own assumptions and
yeah,
grow through your edges, then you're going to come out of it transformed, honestly. I don't think that that's too large of a claim to make. It is a transformative experience. So, and it is for everyone. Everyone who came to the first round of the training came out of it with a different perspective than they came into it with. And from
for sure.
and no matter who they were. So the sort of mechanics of it are it's an 8 week course. It is each segment is dedicated to one topic. We do about an hour of interactive learning and discussion to an hour and a half once a week. And then you have a workbook and you have a little quiz each week. And then we come back and we start each discussion with a recap of the last week's material. And, so those are the mechanics of it. The overarching content is that we are working to create safety.
Hmm.
We're working to create safety and create an environment where folks who are genderqueer, gender expansive, trans are going to feel comfortable coming into our space. So some of the things that we discuss are like, is where my office is located, is it safe? And is it wise to have a rainbow flag in the door, or, and the decal in the door or not?
Hmm.
Right? In some spaces, that is not going to be a gender affirming measure because it may be outing people who don't feel like that's safe for them, right? So it's as you said, there's no recipe, there's no one size fits all, right? It's really a question of coming to the table and saying these are the things that are in play. We talk about sexuality, we talk about um, uh, how our forms are or are not being supportive of our clientele. Everything from like the sort of more sort of humane and interactive to sort of the more EHR side of things, like how do we
Yeah.
retrofit things that weren't made to accommodate
Yeah.
our community, right? So it's a lot of ground that we cover. It is a relatively short course, but we fit a lot into it, and you come out of it ready to start really, really showing up to the work in a way that will create safety for those who need access to care.
Hmm. Yeah. And I think right now we need to be having these conversations.
Absolutely. And especially those
This is,
safety conversations about what does gender affirming care look like? From we talk about having, menstrual products in both or all bathrooms. If you can't have gender affirming bathrooms, if you can't have gender neutral bathrooms, at least make sure that you have products in all of the bathrooms that are going to serve whoever needs to be in there. Right? So little things like that maybe have passed past visibility, but are so important and such a basic signal of this is a safe space.
yes, absolutely. I think I have spent a lot of time with you and we've worked a lot together. Um, I think I know the answers to these questions, but you know, I I'm interested. What what personal transformation did you have as you were writing this book?
Well, it's interesting. I actually wrote much of the first draft under the influence of COVID, which I actually mentioned in the introduction. I was
Uh,
like,
I remember that part. Yeah.
I was down for quite a bit of time, and I
Yeah.
wrote much of the first draft while I was down with COVID, which actually was very interesting because it allowed, I don't know, for anyone who's had COVID, maybe you've also had this experience of it, but it kind of creates a sort of attenuated space. I'm sober, so it was like as high as I get these days. So, a little bit more expansive, a little bit more like not
Yeah.
as sort of nailed down to certain things as I might have been otherwise. It was a little bit more open. Oh, one
Yeah.
of the chapters we didn't talk about at all in this conversation yet is
Yes,
the
we do.
chapter on grief. The chapter
Oh,
on grief.
yes. Yes. We need
And
to
I think
talk
it's
about that.
important to mention, especially in relationship to the COVID experience, because COVID also makes me really emotional. So um, the grief chapter is so it's the turning point chapter. It's the chapter that is sort of like the initiation of the work. So many of us, if not all of us, are going to experience and weather a profound loss um, uh, during our menopause trajectory. Whether, somewhere in there, we're likely to experience at least one profound loss. And that was certainly the case for me. Um, but it's such a duration, right? For many of us, perimenopause lasts at least, 7 years, if not longer.
Hmm.
And so that's a chunk of time, right? So So grief and mourning and moving through and some of it is going to be related to menopause, right? Some of it's going to, for many folks who weren't able to have their own children, for example, who are going through menopause or perimenopause, that there's a lot of grief around the loss of fertility, right? For some folks, there's a celebration of a loss of fertility, and then even when that's the case, there might still be grief. So, and there's no simple, there's like nothing is a simple equation here. So,
Mm.
anyway, just sidebar on that, but that was a big part of the process for me, was being able to write about grief. That was a huge
Mm.
part of my transformation in this. Yeah.
Yes. Yeah. Putting it on paper.
Yeah, right. And also
Yeah.
just coming up with, like, having enough distance on my own sort of traumatic experience that happened when
Mm.
I was in perimenopause. Having enough distance on that to be able to say, how did I survive? How did I survive that loss? Right.
Yes.
And be able to look through and sort of get some threads that made sense. It was very healing.
Mm. Almost re-narrating that time for
Yeah, or
yourself.
at least being able to like piece it together in a more sort of, our the aftermath mind, right? I also talk
Yes.
a lot about I in that chapter I talk about post-traumatic growth,
Hmm.
right? Which was a
Yeah.
concept that I thankfully came across when I was in deep grief. And the ability to move into that frame, like, where is the growth in this for me? Is there growth in this for me? If so, how?
Yeah.
How, what,
Yeah.
why, when, where, you know? And so, like, being able to like really lean into those elements that, I think it's so important. We have such a stunted relationship with loss and grief in our culture. And I think it's so important for us to be able to have those conversations, and even internally to be able to have the monologue dialogue process within ourselves around what loss and grief mean, how they
Mm.
impact us, what they look like, what the ramifications are, and how do we survive? How do we, what makes it worth it? What brings us through? What is the life raft when everything feels like turbulence?
Yeah. Yeah. And hearing, for those of us who are clinicians and reading this, it is that, you know, we also need to hear that, really embodied experience. We need the wisdom of hearing that, um, of understanding what that, hearing at least one account of that. Um, it is so important for us to hear um, trans and non-binary voices in places where we don't normally hear those voices. We need to elevate those voices and hear, what does this sound like? Because I can't assume, um, what that may feel like or sound like to someone else. Um, so again, even just hearing about the grief and feeling like, oh, I have grief, but no, this is a different grief. That
Hmm.
is, it's so important. It's so important for us to um, bear witness to.
Thank you.
So, what comes next for you?
Well, always, there's always a lot
Always.
that's coming next.
You want to write another article?
Yes, I want to write another article. No,
You want to do another presentation?
yes, I do. I absolutely do. I'd love to do more of all of that. My next is my the next certification course, which Kristen will
Mhm.
be coming in as a guest instructor for the gender affirming hormone therapy and MHT segment. And so that's starting at the end of this month, January. So I hope that providers who are in need of that service will be hopping on board. And you can find me through my name, Lasara Firefox Allen. Just search me. My link tree is probably the best way to find all of the points of contact. But yeah, that's the next thing for me. Um,
Awesome.
and more book events coming up this weekend and through the end of the month. And we'll see after that what hopefully maybe something in New York, maybe something in Southern California. So we'll see.
Great. All right. That sounds great. Could you read to us?
Yes, I will read.
That'd be wonderful.
Um, I've been reading this one little segment about from the introduction, actually, which is it's called The Universal They and Gender Neutral and Gender Expansive Language Choices.
Hmm.
Let us take a moment to address languaging and define the terms used throughout this book. Language is the architecture of thought. As we build toward our collective liberation, the words we use count. With new and reclaimed terminology, we create a world of possibilities. Language is constantly evolving. It is to be expected that some of the terminology I've chosen to use in this book will be outdated or replaced by something else within days, months, or years. I recognize that I am confined by the limitations of my perspective and the terminology available at the time of writing. Please forgive any missteps I may make in this regard. I draw on the work toward liberation of those who have gone before me, the work that was done by the intrepid elders and transcestors who carved the space that we exist in now, contributed to my worldview in deep and innumerable ways. I would not be where I am and who I am without their gritty and inspirational existence, nor would I be able to offer forth this work. I also draw on the wisdom and guidance of younger generations. I have learned so much from listening to and witnessing the evolution of thought being brought about by those who are shaping our future even now. And any missteps or miscalculations are my own. Please forgive me where I fall short of the goal of working toward and living into liberation for all. Why genderqueer? With this resource, I wanted as large of an umbrella as possible. Not everyone who is gender expansive identifies as trans. Genderqueer is an inclusive term and one that many of us relate to or may have related to during segments of our gender journeys. I hope that by using this broader term, any queer-bodied folks who have felt isolated or excluded from menopause support and care may find an accessible home here. Folks. Folks is a queer term that has complex meaning. I love it because for me it has a bit of a punk rock vibe while also feeling cozy and inviting. As someone who has always felt like a bit of an outsider, using a term that is in-group protective, kind of like the term queer, makes me feel safe, acknowledged, and at home. I hope the choice of terminology does the same for you. The universal they. In these pages, I utilize they as a universal pronoun instead of he or she. Again, this book is written for a genderqueer and gender expansive reading community. This being the case, using the universal they feels like the affirming choice. I hope that it lands in an affirming way for you too. Further, the term they can include he and she. He and she do not automatically include they. We've heard the examples. They left their coat. They went to the store. They can be a gender inclusive term. If this generalized usage gives you pause, I invite you to sit with any reactions you may have and reflect. If you are cis and used to having a different gender centered in writing, I invite you to feel into your discomfort. Gender is a hot button topic for many of us, and becoming more flexible in our relationship with it may be worthwhile however you identify. If you're trans, gender expansive, or gender queer, and the pronoun they is a stretch for you, I invite inquiry into that response as well. People who experience menopause. A basic premise of this book is that not everyone who bleeds or experiences menopause is female. In genderqueer menopause, I use the terminology people who menstruate and people who experience menopause because this is the basic level of inclusivity. If you are a care provider and take one thing away with you, let this be that thing.
Thank you. I hearing it again makes me take a deep inhale. It is powerful. It is the humility that you show as you acknowledge that this is the the terminology is changing.
Yeah,
Um, that we won't get it right for everyone.
there's no way.
There's no
It's a losing
way.
battle.
It is a losing battle. Doesn't
You
mean we
know,
don't try.
no, we do try. We do try. And my first book came out 20 over 20 years ago now. And so I definitely know how this works. You
Yeah,
know, I
yeah.
mean, uh, I knew even then, even yeah, it's terrifying putting words on a page. It really is terrifying putting words on a page because you know you're going to be wrong within days.
I
You're like,
understand as well. I understand as well.
you know what
Yep,
I'm saying?
yep.
And we do the best that we can, and that's the whole point, right? We continue doing the best that we can. And when we find out that there's a better way, then we do it that way.
Yeah. When we know better, we do better. And
Exactly.
it's starting with that intentionality of
Yeah.
this, we need a better way to do
Yeah.
menopause care. And we have been excluding a entire group. We have just been, we need to do better.
Yeah.
And Lasara, thank you so much for really bringing this work into the published space. The book is beautiful. It really is. And I know I have enjoyed reading it. I have enjoyed um, talking about it. I have enjoyed our scholarship work that has sort of come off of it as well.
Yeah.
And this is just the beginning. We need to keep going.
It's true. It's true. It is just the beginning.
Yeah.
And,
Yeah.
I want to take a moment and just say shout out to North Atlantic Books because this is a funny story, actually. Tim is here in the room, so I'm going to tell it. I posted on my Facebook that I wanted to write this book. And Tim and I had been in conversation about other projects over the years. Nothing had come to fruition yet, but I wrote, I wanted to, on my Facebook wall, I wrote, I want to write this book. And Tim emailed me within I think it was like an hour and a half maybe, and said, we want that book. And I said, oh, okay, let's do it. So it was that fast. And and that was so affirming and such a strong move.
Mhm.
And really made me feel confident in North Atlantic's um, ability to stand in the fire with this topic, which I know that y'all don't shy away from topics um, that may draw a little eyebrow raise, but it just made me feel very confident that this was a wanted thing and that it was going to be well received. So thank you, Tim, for
Thank you. It's really our honor. And today is its first day in the world. And I think it's going to have a really long and fruitful life and reach a lot of people who need it.
Thank you so much. I believe so too, and am very much looking forward to seeing what the trajectory holds for all of us. So, uh, was there anything else? Do we want to see if there's any questions, reflections from our little
Yeah. Is there
gallery?
Does anyone have anything that they found they wanted to reflect upon, anything that you found meaningful? It's okay if that's something that you are reflecting on within yourself. It's okay if you want to bring that forward too.
Yeah, I mean, whole book is about this, but I was thinking if someone asked you, Lasara, oh, how it how is it different for genderqueer folks? How is menopause different? Why do y'all need your own whole book about it? How would you answer that in kind of a concise way?
Yeah, that's a great question, actually. I would say that one of the main differences, honestly, is what I said earlier, which is that genderqueer and gender-expansive folks and trans folks can experience menopause a lot of different ways and can even experience menopause or menopause-like experiences more than once. And that is unique to the trans experience, basically. And the reason that is the case is because if we decide to engage in gender affirming hormone therapy, there's the possibility that our body will respond like to high dose testosterone, for example, with almost a temporary menopause, but you can't call it a temporary menopause because it might actually be permanent for some people. So, it can actually trigger ovarian menopause, menopause by ovarian aging. So it just depends on the person how any kind of surgical or chemical intervention may play out in the long run, which is why when a trans person goes in for gender affirming therapies, that they are, you know, invited to consider whether they want to preserve eggs, for example, right before they would do an intervention, just in case something, doesn't bounce back after they go off the testosterone, right? So some people elect not to harvest eggs beforehand and might try to harvest eggs down the line. They may still be able to do that, but there's no guarantee. You know, so in that case, if someone wants to preserve their fertility, then their safest bet is to harvest their eggs before intervention. So that being the case, there are a lot of different ways that we can experience menopause. So if we decide to get a surgical intervention, if we decide to get a hysterectomy, as I was talking about earlier, it is desperately essential that we are armed with the information that's in this book. Because, and this has been something that I've witnessed, unfortunately, more than once, sometimes medical providers, very well-meaning medical providers who are gender affirming, who want to make sure that you're getting the interventions that you desire, sometimes even the most well-meaning medical providers neglect to illustrate exactly what menopause looks like or might look like, right? Sometimes providers neglect to do a menopause questionnaire beforehand, or like how did menopause impact the people in your family, Um, like those questions are very important to ask before you do a surgical intervention, in my estimation. I mean, Kristin can weigh in on this too, but it is so important that questions like that are asked, because if you don't know the answers to those questions, it's really worth getting that information before you embark.
Mhm. I would say that it's funny you say, well, why do you need your own book? And I'm thinking all of the people in gynecology all the clinicians are thinking, we absolutely needed a book. Like we need a book
Right.
because this is it is first of all, there's an entire generation of clinicians who have no idea what to do with menopause to begin with, but also an entire generation of clinicians who really are not trained in gender affirming care. and then put the two of them together. And oh boy, we have no idea what we're doing, or we
Mm-hmm.
think we don't have any idea what we're doing.
Mm-hmm.
And you think, oh my goodness, this must be a super specialty. Unless I'm a super specialist, I can't do this.
Mm-hmm.
What I want to get across to clinicians is that no, we know how to, if we know what hormones do, and if we know how to provide inclusive, gender affirming, patient-centered care, client-centered care, if we understand what the chemicals are that we are prescribing, if we understand, but if we center the person who's in front of us and we listen to their story, there's no super specialist that needs to happen there.
Mm-hmm. Exactly.
Like that's it's not and so I think that it's changing that frame. But yes, absolutely. This is not you're not going to find a lot of clinicians out there who are saying, yeah, oh yeah, I do gender affirming menopause care.
Right. Yeah. Hopefully in a year or two.
Yes. In fact, when I say that I do gender affirming menopause care, people will say, what is that?
Right, exactly. Exactly. So, so that I mean that is really it. Like through this work, genderqueer menopause is the beginning of a new field of menopausal medicine, basically. In that it is giving us an opportunity to say, as a population that experiences menopause, we have different needs.
Yes.
We have different needs, and we need a different standard of care. And I will bring it back to generalizing out and saying that standard of care that is going to be so different is literally going to serve every single patient that walks through that clinician's door.
Because we don't sort our patients, or at least we shouldn't sort our patients at the
Right.
beginning,
Ideally.
ideally. Um, but in reality, if you start with, there's no assumptions to begin with. That's where it starts. You can't, there's not, I'm not doing gender affirming care today. It's always gender affirming care.
Hmm. Right. Exactly. Thank you for that question, Tim. That was a great question.
Mhm.
Does it feel answered?
Totally.
Mm.
Anything else? Or do we wrap? Okay.
Thanks so much,
Yeah, this
both
was
of you.
great.
It was a great conversation. Yeah, thank you.
Mm.
Thank you so much for being here, Tim. Deeply appreciated.
Yes.
All
Well,
right.
I could
Well,
talk all night. I'm
yeah.
telling you. You know that.
I
You know I
know.
could talk all day, all night.
Kristen's a good
Fine.
talker. That's why we do so well together.
Yes.
If there isn't anything else, then I just want to thank you, Kristen, for holding the space for me tonight for this launch. And this will be up on my YouTube channel and up on my podcast channel. And I'm just so grateful to you for holding this experience for and with me tonight. It really feels very nurturing and sweet, and I'm so grateful. And I'm so grateful, Tim, for you hanging out. And Robert, thank you for being here. And just super ecstatic to have this little baby out in the world.
Yes.
There it is. So yeah, so thank you all for being here. Thank you so much again, Kristen, for your wisdom and your input and also just for holding this space so beautifully. Thank you.
Well, thank you for having me. This was great. All right.
All right. Goodbye all.
Goodbye.
Bye.